So, hello friends, I'm Gagana. I'll be teaching functional anatomy of the eyes from the special senses. So, the eye has two parts from outside. So, cornea as well as the sclera. Cornea as well as the sclera. So, the cornea is 1/6 of the sclera. Cornea is 1/6 of the sclera. It is a transparent layer. It is a transparent layer and it is a bit more convex. You can see it is a bit more convex. 1/6 of the sclera. So sclera is the outermost membrane which is white in color. Cornea is black in color. Sclera is usually white in color, and the sclera is the white part of the eye. So next we'll be seeing the three layers of the eye. The three layers of the eye. Outermost is sclera, the middle layer is choroid, and the innermost is retina. Sclera is the white part. Choroid is a pigment. It is a layer, it's not a pigment, it's a layer which consists of vascular pigments. So choroid consists of the blood vessels. It gives blood supply to the eye, as well as the retina. It is the innermost layer. You can see this orange part. It is the innermost layer of the eye which have some photosensitive pigments. There are two photosensitive pigments called as rods as well as cone. Retina has two pigments called as rods as well as cone. Next, there are two chambers in the eyes. So the two chambers of the eyes are aqueous humor, which consists of aqueous liquid, and vitreous humor, the bigger one, which consists of vitreous liquid. So next we'll study about all these structures as deeply. Next, you can see there are ciliary muscles. Red one, so which helps in the pupil constriction as well as the dilation of the eyes. So ciliary muscles helps in the pupil constriction and dilation of the eyes. There are lens. So lens is very important structure. So the lens is biconcave in shape. As you can see, the lens is biconcave in shape. It is avascular structure. It is avascular structure and elastic. So lens is biconcave in shape. It is a avascular structure and elastic in nature. So the ciliary bodies helps for the dilation and constriction of the lens. Ciliary muscles help for the constriction dilation of pupil. Ciliary body helps for constriction and dilation of the lens. Next, we can see there is a area called as macula lutea. It is a oval shaped pigment which helps us to see and for the color vision. Macula lutea is a oval shaped pigment which helps us to see. Then comes the Fovea Centralis, a small triangular area which is located in front of macula lutea. So the blind spot is also there, and the optic nerve. You have seen optic nerve. It is the second cranial nerve. Optic nerve is the second cranial nerve. There are also some suspensory ligaments which help for dilation and maintaining the length, width, girth of the lens. Now we'll move on deeply to each and every structure of the eye. First, I said there are two chambers, aqueous humor, vitreous humor. So aqueous humor is a very important question. This is just a general structure, but aqueous humor is very important question, usually asked for 10 marks. This is like some pakka question. So aqueous humor is a thin fluid present in front of the retina. It is present in front of the lens. So can you see the lens here? Yeah, the fluid which is present in front of the lens is called as, it is present in front of the lens. So it is a liquid which is present in front of the lens. This one. So it fills the space between cornea and I have written lens everywhere, retina everywhere. It's lens. So it is the space between the cornea as well as the lens. The space between cornea as well as the lens. So the aqueous humor has two parts, anterior chamber as well as the posterior chamber. So this is the aqueous humor. It has two parts, anterior chamber as well as the posterior chamber. Both the chambers will communicate with each other through the pupils. So as you can see in this diagram, this whole thing is aqueous humor. This is the pupil. So this is the anterior chamber. This is the posterior chamber of aqueous humor. Next we'll look of the properties of the eye. So this is just easy, I'll tell you. Don't write this 1.0, 1.3. See, remember, volume is 0.1. Volume is 0.1 milliliter. pH is 7.5. Alkaline. Eyes are alkaline in nature. Viscosity, refractive index, just remember it as 1. No need to specify everything. So properties, viscosity, refractive index is 1. Volume is 0.3. pH is 7.5. Alkaline. Composition. What is this aqueous humor made up of? 10 marks question. So you have to explain each and everything. The structures, classification, properties, composition, its formation, then circulation, everything. So composition. Aqueous humor has two composition. Water, 98.7%. Most of the part is filled with water. Solids is 1.3%. So solids are classified into two. Organic substance, inorganic substance. Just remember 1 or 2, that's enough. So albumin, globulin. Don't write fibrinogen. So albumin, globulin, glucose, pyruvate, lactate. Just remember albumin, globulin. Inorganic substance, write everything: sodium, calcium, potassium, magnesium, chloride, phosphates. Sodium, calcium, potassium. Remember sodium, calcium, potassium, albumin, globulin. So now we'll look after the formation. So eyes is formed by the ciliary process. The aqueous humor is formed by the ciliary process. Aqueous humor is formed by the ciliary process. So there are three processes. Dua. Remember it as dua. Smoke. So dua. Diffusion, ultrafiltration, active transport. Diffusion, ultrafiltration, active transport, dua. Next, after formation, aqueous humor reaches the posterior chamber by passing through the suspensory ligaments. You can see the diagram here. This aqueous humor will be passing through the suspensory ligaments and moving towards the vitreous humor. So next thing, see, after formation, aqueous humor reaches the posterior chamber by passing through the suspensory ligaments. Posterior chamber is near the area of suspensory ligaments. Anterior chamber is near the area of pupil. So you can see the diagram properly. So you can see the diagram. Cornea is here, lens is here. As I said, this is the pupil. This green part is pupil. This is the anterior chamber, and this pink one is the posterior chamber. Anterior chamber plus posterior chamber is called as anterior segment. Anterior segment. So which is filled with aqueous humor solution. So let us look after the functions of the aqueous humor. Very easy. See, it helps to maintain the shape of the eyeball. See, maintains the shape of the eyeball. Intraocular pressure gives nutrition as usual. Nutrition, oxygen, electrolytes, and metabolic waste removal, everything. So metabolic waste, nutrition, O2, electrolytes, intraocular pressure, and shape of the eyeball. So now we'll see about the circulation and drainage. Very, very important. Very important part. So circulation and drainage. First, what happens in the sense, blood supply. Circulation is nothing but blood supply. So formation of the ciliary process. So there will be formation of the ciliary process through the space between the suspensory ligament. As I said, there are suspensory ligament here. There is lens here. So there will be formation of the ciliary process, and there will be posterior chamber, anterior chamber. So there will be posterior chamber, anterior chamber, and there is a pupil in between them. I said you that time. So the space between the anterior chamber and posterior chamber is differentiated based upon the pupil. So posterior chamber through pupil, anterior chamber, then it passes through the limbus. So limbus is a structure which is present near the cornea. So then it passes through the mesh-like structures called as trabecula. Trabecula, remember T. So it is a T-shaped structure. Then through the canal of Schlein and venous system, aqueous venous. See, I'll be explaining the circulation and drainage through the diagram. From the lens, it moves through the ciliary process. Then it moves through the suspensory ligaments. So these are the suspensory ligaments. Lens ciliary epithelium, suspensory ligaments. Then it moves through the posterior chamber. So this is the posterior chamber. You can see pupil here, anterior chamber, posterior chamber. Posterior chamber passes through pupil, anterior chamber. So limbus is the distance between the cornea and the iris. So distance between the cornea and iris is the limbus. You can see here limbus. So after passing through limbus, it passes the mesh-like structure, meshwork, spongy. It is a mesh-like structure, T structure called as trabeculae. From the trabeculae, you can see the canal of Schlemm. This is the trabeculae, canal of Schlemm. From there, it passes through the venous system, goes on, aqueous veins. Next, so 10 mark question we have deal with it. Aqueous humor. Next comes the glaucoma, very very important eye disease. So it is a group of eye disorder. You can see the three main characteristic functions in that. Increase in the intraocular hypertension of the eyes, increase in the pressure inside the eyes. Optic nerve is damaged. So if this is the eye and up to this thing, I can bear the pressure. If the pressure increases more than that, like eye pressure increases, then glaucoma occurs. So there will be damage in the optic nerve. We have seen in the diagram, optic nerve passes behind the retina. So there will be damage in the eye, which leads to blindness. So we have studied about the anterior chamber, posterior chamber. Where is it located? Vitreous humor is located between the lens and back of the eyes. See, the vitreous humor is present between the lens and back of the eyes. Cornea and lens is the anterior chamber, aqueous chamber, everything we have studied. So I have explained about this diagram, about the drainage, how it moves, everything. So remember two structures, trabeculae, limbus. Limbus is the distance between the cornea and the iris. This is limbus. And trabeculae is this mesh-like structure. Canal of Schlemm is the green-like structure. So we'll look after the glaucoma. So what happens in this? The drainage system is blocked, intraocular pressure increases, I said pressure will increase, optic nerve gets ultimately damaged and will lead to blindness, vision loss. So glaucoma is of two types, open angle glaucoma, closed angle glaucoma. Usually the common type is open angle glaucoma. Glaucoma is a very very important topic. Just no need to study deeply about these both, but just you have to know, like you should have the idea about what is open angle glaucoma and closed angle glaucoma. So in open angle glaucoma, what happens in the sense, if this is the cornea and this is the lens, so the angle between cornea and lens is open. So the blood clotting will decrease. Slow blood clotting takes place because there is increase in pressure. So there will be increase in the pressure here. So the clotting time in between, this clotting time will be slow because there is increase in pressure. So obviously then if this is the optic nerve, there will be compression of the optic nerve, and ultimately it leads to vision loss. So complete vision loss takes place in open angle glaucoma. If we discuss about the closed angle glaucoma, the angle between cornea and the eye is narrower. So the angle between cornea and the angle between cornea eye lens was big. In this closed angle, the angle between cornea and eyelets have decreased. So lens is pushed against the iris. So here the drainage itself is blocked. Drainage itself is getting blocked because there is no pressure, and what happens? There will be pressure inside, the pressure inside will be developed. There will be development of pressure inside the eyes. It causes eye pain, swelling, reddishness of the eyes, blurred vision, you can't see the things properly. You get headache, nausea, all these symptoms. Eye pain, reddishness of the eye, blurry vision, headache, nausea. So understood the difference between open angle glaucoma and the closed angle glaucoma, which is the common one, open angle glaucoma. Open angle glaucoma, closed angle glaucoma. Remember these two symbols, open angle, closed angle. Open angle, closed angle. So what are the diagnoses? Like how can you understand? By doing tonometry. So tonometry is an instrument which will tell whether the intraocular pressure of the eyes is more or less. Second one we can do by visual field testing, like testing the field of the eyes. So third we can look by imaging the or by direct observation we can find whether the optic nerve is damaged. You have the Sneller's chart, everything. So by that you can diagnose. So what is the treatment given to the patients who have glaucoma? So what we have to do in the sense, the pressure have increased, we have to decrease the pressure. So decrease the production of aqueous humor and increase the outflow of aqueous humor. So production have to be decreased, outflow have to be increased. Production have to be decreased, outflow have to be increased. Or you can do both. There are, if the condition is excreting, like increasing drastically, then there are three more options: trabeculoplasty, iridotomy, implants. So these are the laser treatments. Okay, implants by implanting that part, or iridotomy is nothing but replacement of iris, surgical removal of iris, or trabeculoplasty is nothing but treatment of the trabecula, meshwork like structure. Now we'll deal about the IOP, intraocular pressure. Very important 3 marks question. So very important 3 mark question. IOP, intraocular pressure. What is the normal? This you have to remember. Okay, this is very important. So intraocular pressure is nothing, it's between 10 to 20 mm per Hg. 10 to 20 mm per Hg, remember that. So how is the pressure formed? From lens, write all the parts, nothing but just write all the parts. So lens, aqueous humor, vitreous humor, blood vessels, elasticity of 3 layers. What are the 3 layers of eyes? Choroid, sclera, retina. Sclera, choroid, retina. Next, what does intraocular pressure maintain? So this pressure helps to maintain the shape of the eyeball. It helps to maintain the shape of the eyeball. So what does this intraocular pressure helps for? Like if this is the layer retina and this is the choroid, so it helps to keep intact the retinal layer and the choroid layer so deeply, like so clearly. Their surfaces will be attached so that you can get a clear image, clear vision. So IOP is measured using the tonometry, and variations of IOP depends upon the amount of aqueous humor present at any given moment. Increase in IOP, that is causing glaucoma, what I said that time. So remember 3 things. What is the normal intraocular pressure? 10 to 20 mm per Hg. What is how is the IOP measured? Tonometry. And what happens if there is increase in the IOP pressure? Glaucoma. So next question is, mention the part of retina with highest visual acuity. Macula lutea. Sorry, it's not macula densa. It is located in the kidney. So macula lutea, important, macula lutea, or you can also write the Fovea Centralis. So macula lutea or Fovea Centralis is the part of the retina with highest visual acuity. Why? Because it is the most sensitive area of the eye. It is the yellowish pigment which is most sensitive area of the retina. It is the most sensitive area of the retina. This question is very important. Remember, just it might be asked for 3 marks. The part is macula densa or Fovea Centralis, and yellowish pigment, most sensitive area of retina. Next we'll study about the Fovea Centralis, that triangle shaped structure. So macula lutea is central part and has a small depression. Don't remember this, just leave that. So macula lutea have a small depression. If this is macula lutea and there is a small depression in that, so it is called as Fovea Centralis. So most sensitive part, and it has high visual acuity. Why? Highest visual acuity, very very important. It has highest visual acuity. So remember, in Fovea Centralis, FC Centralis, it is a layer which consists only of cones. Only cones are present in Fovea Centralis, and it is tightly packed with each other. It has only cones. Remember, Fovea Centralis, see, cones. So ratio of cones and ganglion cells, just remember this, 1:1. Next, don't remember all these things. Remember your nutrition. So how does the Fovea Centralis get the nutrition? By the choroid blood vessels. They get nutrition by the choroid blood vessels through the diffusion. Next we saw the structure blind spot. Here there was a structure called as blind spot. So we'll look after the location and cause of the blind spot. So blind spot, this blind spot is an area where there is no rods as well as cones. Blind spot is an area where there is no rods as well as cones. You have studied all this in your class 12. So it is insensitive to light. That is, if a dark light or an object falls on this area, then you cannot see this properly. Why? Because the rods and cones are absent. So if a bright light falls into your eyes, and if you look a bit that side, then you can see everything blurred, dark. So it's because of the blind spot, because rods and cones are absent there. Where is it found? Near the optic nerve, blood vessels, where the blood vessels are leaving the eyeball. I have showed you. So this is a blind spot, optic nerve, where all these blood vessels passes. So blind spot is located here. Rods and cones are absent here. Next, the diagram is about the intraocular muscles. IOM, intraocular muscles. So this is the central part. Elevation, depression, abduction, adduction. Elevation, depression, abduction, adduction. LR, lateral rectus, medial rectus. Superior rectus, inferior rectus. Inferior oblique, superior oblique. So total there are 6. Just 6 remember. See, superior rectus, inferior rectus, medial rectus, lateral rectus. Superior oblique, inferior oblique. Superior, inferior, medial, lateral rectus. Inferior, superior, oblique. Now we'll study about the action of these muscles. Very easy. So see, now we'll study about the superior rectus as well as in superior oblique. See these things properly. Ulta, elevation, depression, adduction, abduction, but same thing is intorsion. Intorsion is the same thing. Superior rectus, superior oblique. Elevation, depression, adduction, abduction, intorsion. Another easier one is medial rectus, lateral rectus. Medial rectus, lateral rectus. Adduction, abduction, medial adduction, lateral abduction, medial adduction, lateral abduction. Inferior rectus and inferior oblique. Superior rectus, opposite is inferior rectus. See, now see, we'll study all these 3 first. We'll study these 3 first. Superior rectus, inferior rectus. Elevation, depression. Adduction is same. Intorsion, extorsion. Medial rectus is adduction. So for all the 3 rectus, there is adduction. Elevation, depression, intorsion, extorsion. Now we'll study the rest 3. Medial rectus is adduction. Lateral rectus is abduction. Superior oblique, depression, elevation. Abduction, same thing. Oblique has abduction. Rectus has adduction. Superior oblique, intorsion. Inferior oblique, extorsion. Whereas in that case, superior rectus, intorsion. Inferior rectus, extorsion. So last, we'll be dealing about the constriction and dilation of the pupil. What is constriction and dilation? Remember, constriction, dilation. Constriction, dilation. Constrictor pupillae for constriction, dilator pupillae for dilation. Constriction pupillae is formed by the constrictor pupillary muscles. Dilation pupillae, easy, formed by the dilator pupillary muscles. It has circular circular muscle fibers. It has radial dilator muscles. It helps for constriction of pupil, dilation of pupil. Easy. Constrictor pupillae, constriction. Dilator pupillae, dilation. Constrictor pupillae formed by constrictor pupillary muscles. Dilator pupillae formed by dilator pupillary muscles. Circular C, radial D. Dilation, constriction. So guys, to conclude, I have completed 2 chapters: functional anatomy of eye, movements of eye. Trust me, study only these 4 important questions. Aqueous humor for 10 marks, GLYCOMA for 3 marks, IOP, intraocular pressure devices tonometry to measure it, 5 marks, intraocular muscles, 5 marks. Study these 4 questions from these 2 chapters, more than enough. So guys, if you like my channel, please share, like, subscribe. Thank you.